Morning, Doc.
Good morning po.
Good morning mga babies. What's up? Hello.
Morning, Doc.
Good morning,
Doc
Doc.
Lala.
Good morning, Doc Umalin. Hi, Doc Ian.
Hi, good
Hello.
morning.
Yo, Doc. Morning, Doc Broly.
Ay, naman si Doc Broly.
Naka-mute po
Good
kayo, Doc
morning, Doc
Broly.
Broly.
Naka-mute po kayo.
James, Lala, yeah, good morning. Good
Good
morning,
morning, good morning.
Quiz Masters. Kasi itong Quiz Masters, nag-enjoy ako dito.
Happy Valentine's Day po.
Ayan, happy Valentine's, everyone.
Happy Valentine's, guys. Iwas muna sa mga motel. Aral muna.
COVID daw, COVID.
Exam muna.
Now, books before boys. Yung. We still have 3 minutes bago mag-live sa portal.
Bigay mo na ako din
Shout out sa mga
I'll give a short intro muna sa Quiz Master. Then chikahin ko ng konti si James regarding yung thoughts niya sa Biochem for the last 2 board exams and the recommended tactics. Kung paano mag-aral with, 3 weeks to go? 3.5 weeks to go before your board exams. Okay? Tunay na buhay na to, guys. Kailangan magbagong buhay na tayo from this point onwards.
Tahimik na tahimik sila ngayong umaga.
James, may gym na nga pala tayo sa sa Top Notch. Ay, hindi ka dumadaan, no?
Hindi pa po eh. Gusto ko nga po dumaan one of these days.
Pwede tayo sa gamit doon.
Workouts.
Guys, use your laptop ha para mabilis kayong masagot. Kasi pag iPad natatakpan yung questions, diba? Na, 1 minute. Okay, so good morning, everyone. Happy Valentine's Day sa lahat. Alright, sana mainit ang inyong Valentine's Day. Okay, para latong painitin ng umaga, we will have our Quizmaster session this morning. Okay, and we will start off with Biochem. But before we start, Dr. Banzuela will give a few words of wisdom and a few reminders.
Okay, let me share my screen first. So for the next 2.5 weeks, you're going to have your Quiz Master sessions. There are 2 rounds ng Quiz Master session. So there will be 1 Quiz Master in the morning, 1 Quiz Master in the evening for 12 subjects for 2 rounds. So even until I think between the day 2 and day 3 of your board exams, di ba may 5 days na pagitan yon, you're still going to have Quizmaster sessions during that time. So, Doc, ano tong Quizmaster sessions na to? Quizmaster session, so we have done this last November, 2021 batch. It's basically a morning and afternoon synchronous quiz via Zoom and via the Top-Notch online portal. Okay, given by recent board exam top-notchers and board exam passers. Okay, to serve as a way of final preparation for your board exams. It's also a way for us to help modulate, to help regulate your time management pag malapit na yung boards. Kaya very strict yan eh. Parang to the dot, 8 a.m. may session, 8 p.m. may session. Ganyan yan every day for 2.5 to 3 weeks. By doing that, na synchronous, kailangan yung attendant, well, kailangan yung gumising ng maaga, kailangan mag-attend kayo on time, okay? So, imaginein mo lahat kayo magkakabarkada ngayon, kailangan nyo mag-attend nito. So, gigising kayo at the same time, okay? Mag-attend kayo at the same time. To make this very, very efficient, my recommendation will be for the Quizmaster, isabay ninyo sa breakfast and sa dinner. Mag-breakfast kayo ng 8 a.m. to 8:30, mag-dinner kayo ng 8 p.m. to 8 p.m. to 8:30 p.m. I give instructions naman to the teachers to keep it as much as possible to 30 minutes, 40 kung hindi talaga kaya, okay? But to keep it at around that time para hindi masyadong toxic sa mga tao. 'Di ba? Magandang habang nagkakape sa umaga or habang nagdi-dinner, you're having this na stimulate yung utak mo. Okay? And pwede ka magtanong dun sa teacher na nag-take ng board exams recently. Okay? So maximize your Quizmaster sessions. Okay? So these are live sessions that is not recorded and won't be uploaded. By default, okay, live talaga siya. Okay? By design, live talaga siya because of the time management requirements. Okay? Gusto namin ma-manage yung time niyo from this point onward. Okay? So you'll have your Quizmaster session 1. The following will be your teachers for the Quizmasters and dummies. Dr. Omalin, Suarez, Rodriguez, Benedicto, Maalat, Dr. Santos, Junik, Dr. Leal, Dr. Huyad, Dr. Shane, Dr. Ramos, Dr. Shara Carmelitan. So ilan dyan yung mga nag-top ng boards? Okay. Maalala ko ba? 1, 2, 3, 4, 5, and I think, and then 6 is Dr. Shara. Okay, there are about 6 board exam top-notchers here. Dalawa top 1, si Dr. Ines Benedicto and Dr. Huya, they're the top 1 noong September and November 2021 na board exams. Dr. James Omalin is also a board exam top-notcher, but previous pa noong 2020, one of our best teachers. Okay, so they'll be tackling, okay, for the next 6 days, itong mga Quizmaster sessions ninyo. Okay. By the way, we're going to start also with the Top-Notch Virtual Library. Pinapaayos ko pa to kasi traditionally napapansin ko, nagsastudy yung mga tao, nag-virtual library sila via Discord na app. Kaso kasi tinitingnan ko ano yung preference ng mga magbabantay sa inyo eh. Itong virtual library, we're hoping na, of course, nandyan yung Mother Goose, nandyan some of the mentors. Okay? And then, gusto ko sana magkaroon ng lecturette na very short, mga 20 minutes, 30 minutes from the teacher, somewhere down the line. So, inaayos namin to. Just stand by for additional announcement regarding the Top-Notch Virtual Library. But this is a way for you to virtually, again, study with someone else. Study with a fellow classmate. Okay? Study with a fellow batchmate taking the March 2022 Med Boards. Okay? A bonus lecture, your Pedia Phase X, okay? It's already ready. However, nung nag-usap-usap kami dito, I gave instructions that this will be released only between day 2 and day 3 ng board exams. Yung 5 days na pagitan, sabi ko doon nyo na lang i-release yung bonus lecture kasi right now I want the students to actually focus on the main handouts rather than doon sa bonus na Phase X. Maganda yung Phase X. This was done by Dr. Ian De Vera. I really would recommend that you watch it. Pero yung timing nito, wag nyo munang panoorin ngayon, wag nyo munang basahin. Sabi ko, gawin natin to pag ano na, doon sa 5 days na pagitan. This will be around 3 to 4 hours lang naman. But very, very useful. Okay? And I think ang tamang timing will be around that time. So we're going to release this March 8, 2022, between day 2 and day 3 ng board exams ninyo. Okay? So you're going to be guided. Magkikita-kita ngayon tayo, umaga and then gabi. Mamaya you're going to see me again. Okay? Right now, so we're going to have Biochem for your quiz master session. We have here with us Dr. James Umalin. Okay? Si Dr. James, ang isa sa mga teacher ko na huling nakaranas ng on-site na program ng Top Notch. And then naranasan din niya yung online na program ng Top Notch. Nandun siya sa transition. So nakita niya kami, honestly guys, ang best talaga is on-site. That's really the best. Yung on-site program ng Top Notch, it's an experience eh. It's really something na parang, shit, sana ganito yung sa med school. Ganon yung feels. We try to do it as much as possible for an online setting, but it's really not the same. Eh, iba. So Dr. James was able to experience that. So he was able to help us transition. Okay. For Biochem, he's a very, very good teacher. Okay. Dr. James, again, your tips in a nutshell for Biochem for our students.
Hi everyone, no, good morning. For Biochem, hi Dr. Brody, good morning. For Biochem, paano ba yan? For the past few years, actually, ang naabutan ko, nung nag-exam ako, metabolism pa din. Although, the next exam after that, no, kung yung March, no, March 2021, nagbago ng trend, no, naging more of nutrition, more of RDAs, gano'n. Basically, something that you wouldn't find sa mga biochem textbooks but rather sa mga nutrition textbooks or internal medicine textbooks na merong clinical nutrition. Although, for the latest, no, yung mga September, November 2021, it became, bumabalik na ulit yung mga basic biochem, mga pathways, for instance, yung mga favorite natin na amino acids, phenylalanine, etc. Pero andun pa rin yung nutrition part, like mga RDA, mga macronutrients, mga vitamins. Vitamins, laging ano yan, laging lumalabas, vitamins, regardless. No? Kasi andun eh, part naman talaga siya ng biochem. So, basically, when it comes to studying your biochemistry, it's important pa din na we study biochemistry appropriately and formally. No, nandun yung clinical biochemistry, metabolic biochemistry, then isusupplement natin with our nutrition, no, clinical nutrition. Although that's ano naman yun eh. Tawag natin doon, tie up naman with internal medicine or clinical nutrition. No, so hindi naman tayo mahihirapan. For my tips sa studying 3 weeks na lang naman, more often than not, I think tapos na tayo magbasa, o kung hindi man, okay lang yun, walang problem. Hahabulin natin, we still have time. Pero at this point, I always tell my students, no, is pag mga recorded lectures that ito hindi ito congruent sa mga phase 1, phase 2 ng Top Notch of learning, pero this is my own phases of learning. So the first phase of learning is taking the knowledge from your books, from your handouts to your heads. That's the first phase of learning. The second phase of learning is from our heads to the answer sheets. So at this point, we must focus dun sa part na we are recalling, we are using yung nakuha nating knowledge to answer the questions. In short, we must practice with answering questions. Just like best analogy ko dyan is, for instance, you're a basketball player. You are training for a basketball game. How do you train weeks beforehand? You play basketball. For instance, you are a guitar player in a band for band rehearsals. How do you rehearse for a gig, for a concert? No, di ba, you play the guitar, you rehearse with the band. Same with board exams. Now, in our exam day, we are going to answer questions. Sorry, dogs. We're going to answer questions. Now, how do we train to answer questions? we answer and answer and answer question and answers. Of course, andun dapat yung rationalization. And kung merong discrepancies, we must go back dun sa main handout lagi. No? So ayun, that's short tips for the upcoming boards.
You've been given two major handouts here. The one created by Ronnie Baticolon based on must-know biochem. And then the handout given by Dr. Franz Rubio, that is colloquially termed pre-med biochem. Please take note that in the board exams, mas powerful, mas effective, mas high yield yung kay Rubio. Even though in the clinics and in real life, hindi siya talaga nagagamit. Mas importante clinically yung kay Dr. Ronnie Baticolon. So be aware of those facts. That's what we have as feedback for the past 1.5 years. Okay? Pre-med biochem, yung kay Rubio ang mas mahalaga for the board exams. Mas mahalaga sa buhay yung kay Ronnie Baticolon. Anong doc ang dapat namin gamitin? Both, but with emphasis siguro kay Franz, yung Rubio handout. Okay? Continue, Dr. Omalin.
Ayun. Doc Rolly, start na po ba tayo ng Quizmaster?
Yes, Doc. Sorry.
Okay po.
Today.
Share na ako ng... Alright. So everyone can see the screen, no? Quizmaster session. Hello again. I'm Dr. James Daniel Omalin. So biochemistry teacher, and without further ado, no, let's start. Wala tayo masyadong images, more of we will rationalize the questions, no? We will rationalize how we end up sa mga answers natin. Pero sige, these questions actually they are fairly challenging, no? Fairly challenging, and for a good reason naman. Okay, so let's start 10 items. First one. Now we have a 2-year-old male that presents with seizures. Now he is not yet able to walk and does not use recognizable words. Now his paternal uncle has intellectual disability. Now labs show an elevated phenylacetate level. Now which amino acid is nutritionally essential for this patient? Ayun. Halfway ng ano natin, sabihin ko yung clue. Okay lang kung may clue or anything. Pero sige, usapan natin later. Anyway, the correct answer to this question is tyrosine, no? Although majority answered phenylalanine. Ito in this Quizmaster sessions, if we answer the question wrong, try our best to forgive ourselves, rationalize natin yan. Pero congratulations if you answer the question correct, no? Phenylalanine, and gets ko why, no? You're thinking of phenylketonuria, and tama naman kayo. But the yung hinahanap natin sa question, no, is what amino acid is essential, not what amino acid is yung nag-accumulate, no? So in this patient, seizure, speech and motor delays, elevated urine phenylacetate, phenylketonuria, tama naman. So may family history din. Sige, ibig sabihin, nakuha natin that phenylketonuria is autosomal recessive. Take note of that. One trick that this is not a hard and fast rule, pero yung sa mga autosomal recessive, autosomal dominant, kapag recessive, more often than not, that is enzyme deficiencies, no? Not a hard and fast rule, pero more often than not ganon, enzyme deficiencies. Pero pag autosomal dominant, usually mga structural defects yan, no? Structural protein defects, mga ganon. Ngayon, tyrosine will be nutritionally essential to patients with PKU and must be supplemented. Okay? Remember that phenylalanine hydroxylase, the enzyme, normally converts your phenylalanine into tyrosine. And that enzyme is lacking in your classic phenylketonuria. No? Now, since yung enzyme na yon naglalak, no, ibig sabihin nagkakaroon ka ng accumulation of phenylalanine, nababawasan ka ng tyrosine sa katawan. Your tyrosine is in normal circumstances ano siya, nutritionally non-essential siya. Pero in the event of phenylketonuria na hindi mo nako-convert yung dietary phenylalanine mo into tyrosine, your tyrosine now becomes nutritionally essential. Okay? Insufficient tyrosine. Okay, so tyrosine normally kailangan yan for neurotransmitter production, no? Kailangan siya for thyroid hormone production, thyroxine production. Also, tyrosine is also required for melanin production, no? Kaya in some cases or most cases of PKU, usually nagpe-present din sila with fair complexion because of that relative deficiency of your tyrosine. Ngayon, other symptoms, usually kapag narinig natin, musty body odor, no, or mouse-like body odor. Do not confuse that, no, with sweet-smelling urine, no, with mouse-like smelling urine. Pag sweet-smelling urine, kasi usually napagbabaliktad yun phenylketonuria and maple syrup urine disease. Sweet-smelling urine, maple syrup urine disease. It makes sense. Maple syrup, sweet, no? Or burnt sugar, no? Yun yung mga maple syrup urine disease. Pero kapag musty or mouse-like, think of phenylketonuria. Okay? So, gets bakit bakit tyrosine yung naging nutritionally essential. Okay? Phenylalanine yung nag-accumulate. Tyrosine yung nagiging essential because of the deficiency of your phenylalanine hydroxylase. That's your classic phenylketonuria, ha. Meron pa tayong another form of phenylketonuria. That's your atypical phenylketonuria, and that's actually the deficiency of the cofactor naman. Cofactor of phenylalanine hydroxylase, your tetrahydrobiopterin. And that cofactor is also a cofactor of your tyrosine hydroxylase, no? So, not a part of this questions then, pero it helps to know na meron tayong dalawang klase ng phenylketonuria. Okay? So, this is clear, and let's move on to our next question. Okay, now we have a 35-year-old female that presents into the emergency room 20 minutes after being rescued from a fire in her house. Now, she has nausea, headache, and dizziness. Now, pulse oximetry shows an oxygen saturation of 99. Okay, now what is the mechanism of toxicity of the substance that most likely causes her symptoms? So, two-step question siya. Now, before we answer the question, we must know ano yon, no? Ano yung substance na yon? Although, this is, ano naman siya eh. Okay. Sige, very good, no? Majority got it correct, 79, no? The correct answer here is competitive binding to heme. Okay? Now, this is actually consistent with your carbon monoxide poisoning. Okay? Fire in her house, nausea, headache, vomiting, no? Nausea, headache, and dizziness, history of exposure sa fire, no? That strongly suggests your carbon monoxide exposure. Now, your carbon monoxide, it is a colorless, tasteless gas with much greater affinity for hemoglobin versus oxygen. This results to carboxyhemoglobin that forms, carboxyhemoglobin that has a decreased oxygen carrying capacity. And if you have carboxyhemoglobin tapos decrease yung oxygen carrying capacity mo, that shifts the oxygen dissociation curve to the left. So, if to the left, that's your ang mangyayari, you will have decreasing, no? You will have decreased release of oxygen to the tissues. Bale, hinohoard, no, ng red blood cells mo yung oxygen. Imbis na i-release niya sa tissues, hinohoard niya. Yun yung nangyayari in carboxyhemoglobin. So another other common findings no in carbon monoxide poisoning include your cherry red skin tone as well as metabolic acidosis. It makes sense no, hindi tayo makapag deliver ng oxygen, acidosis talaga, no. Pulse oximetry, no. Usually pulse oximetry in patients with carbon monoxide poisoning is normal, no. And treatment no usually in your carbon monoxide poisoning should receive no 100% possibly hyperbaric no oxygen to offset your carbon monoxide bound to heme. No, basically again no, medyo mahaba yung explanation. So carbon monoxide magbabind sa heme more with higher or with greater affinity, no? Carbon monoxide magbabind sa heme with greater affinity. So hindi niya that will shift the hemoglobin dissociation curve to the left. I-hoard niya yung oxygen, hindi niyo maibigay sa tissues, tissue hypoxia. So competitive binding sa heme. Competitive kasi madi-displace naman yung carbon monoxide if you increase the oxygen level, kaya nga nag 100% oxygen tayo or hyperbaric. Okay? So that's clear for question number 2. Let's move on no, to question number 3. Okay, now we have a 59-year-old female that presents for a routine exam. Okay, now this patient exercises regularly, diet consists of vegetables, fish, and grains, avoids processed foods. Now your physical examination is unremarkable. Now she is most likely to have an increase in which of the following laboratory markers? Easy. This is fairly easy. Yeah, oh no. Increase. All right. Majority got it correct, 95%. It's your HDL. Very good, no? This is fairly easy. Very healthy lifestyle, no? Very healthy lifestyle. Moderate, sorry, hindi ko nilagay sa choice questions na yung moderate alcohol use, pero in patients with moderate alcohol use, yun din yun, no? Exercise, healthy diet, you would have high density lipoprotein or your HDL. HDL, good cholesterol. Low LDL, low bad cholesterol and triglyceride levels. Now, normally, your HDL transports cholesterol from the periphery to the liver. No, that's your reverse cholesterol transport. Then your cholesterol will then be cleared from the body. No, as a result, no, increases in your HDL has protective properties against your atherosclerosis and has an inverse association with your coronary artery disease. So we have different factors that have been shown to be associated with increase in HDL that include yung aerobic exercise, consumption of fiber, omega-3 fatty acids, so moderate consumption of alcohol, no, wine, no. Now your HDL synthesis, again, no, for reiteration, it is increased by your moderate alcohol consumption. So this explains the association between moderate, no, the word here is moderate, no, moderate alcohol intake and reduced risk for atherosclerosis. So gets naman no. Maganda yung lifestyle, ano yung tataas? Edi yung good cholesterol, no? So HDL. Okay? Okay, formal rationalization lang. Okay? Sige, now next. We have a 10-year-old male that presents with blurring of vision. Now, this patient is at the 99th percentile for the height. Now, physical examination shows joint hypermobility, high arch palate, long and slender fingers and toes. I think meron na tayong iniisip dito. No? Slit lamp exam shows bilateral superotemporal lens subluxation. Now, these findings are most likely caused by a defect in which of the following proteins? Okay, another two-step question. Another two-step question. Okay, I think meron tayong iniisip na diagnosis in mind. Alright, majority got it correct, although meron tayong tie-up na doon sa mga nag-answer ng collagen. No? So, definitely hindi siya collagen, and this is fibrillin. Ano ba to? What's our diagnosis? This patient presents with features of Marfan syndrome, no? Tall stature, high arch palate, arachnodactyly, no, yung long slender fingers and toes, no, joint hypermobility, superotemporal lens subluxation. So this is Marfan syndrome. Now, your Marfan syndrome is caused by an autosomal dominant, okay, dominant mutation in the fibrillin-1 gene, which encodes your fibrillin, which is an extracellular matrix glycoprotein. Okay, that forms a supportive sheath around your elastin. So again, no, autosomal dominant, pag yun yung kapag autosomal dominant yung condition, most likely deficient is structural proteins. So dito, fibrillin, di ba? So again, not a hard and fast rule, pero it can save you. Okay? So anyway, kapag ang nangyayari ulit, yung fibrillin mo nagpo-form ng supportive sheath around your elastin. So without your fibrillin, you will have abnormal elastin production, and you will have defective connective tissue and excessive growth factor release. Kasi defective yung connective tissue mo. Sabihin ng katawan mo, hindi pwede yon. Kailangan natin ayusin. So the tendency is magre-release ng growth factor. So excessive growth factor release, no? So other features of your Marfan syndrome include your vascular abnormalities. No, for instance, your aortic aneurysm or dissections, no? Let's talk about since nagkaroon tayo ng tie-up with letter B and letter C, type 3 and type 1 collagen. So defective type 3 collagen, that's not Marfan's, that's your Ehlers-Danlos, no? Understandable naman kasi nakakalito naman talaga yung dalawa, pero the defective type 3 collagen is your Ehlers-Danlos, particularly your vascular type. Okay? Vascular type. Now your defective type 1 collagen, that's your osteogenesis imperfecta. So tama naman, no, it can present with joint hypermobility, pero patients with osteogenesis imperfecta do not have your lens subluxation, tall stature, arachnodactyly, yung mga Marfanoid characteristics. Sige, to complete, yung laminin na, no? Defect in your laminin can cause your junctional epidermolysis bullosa. Basically, condition siya that is characterized by your fragile skin that easily blisters. So wala naman ganun sa vignette natin. Alright? So gets ba't hindi siya collagen and bakit siya fibrillin? No, again, yung yung cheats natin with autosomal dominant and autosomal recessive, usually kapag autosomal recessive, enzyme deficiency, kapag autosomal dominant, usually structural protein yung problem. Not a hard and fast rule, but it can save you. Okay? Sige, let's move on. Now, we have a 25-year-old female, okay, that presents with a self-inflicted laceration accidentally while chopping vegetables. Now, you use hydrogen peroxide to clean the wound. Now, which of the following is the most likely mechanism of action of your hydrogen peroxide? Okay. So this is fairly easy, fairly easy. Tie up with your patho din, no? Again, no, isa pang harmless advice is that in board exams, if pupunta tayo sa board exam site, tapos halimbawa, mag-exam tayo ng biochem, syempre, dapat hindi lang biochem yung baon natin because in the boards, everything will come out in everything. No? You will have pathology in your biochem, you will have internal medicine in your OB-GYN, you will have everything will come out in everything. You will have legal med in your pharmacology, mga ganon, no? So, be ready, no? Be ready. Hindi kasi ibig sabihin na biochem yung subject, puro biochem lang. Everything will come out in everything, so be ready. So, majority got it correct, no? Letter D, it's formation of your free radicals as hydrogen peroxide is an oxidant. Okay, so hydrogen peroxide oxidizes your cell membrane lipids as well as your intracellular proteins and DNA by forming your hydroxyl free radicals, no? H2O2 hydroxyl, no? So your hydrogen peroxide is used in wound disinfection as well as surface disinfectant and is believed to be active against bacteria, yeasts, fungi, viruses as well as spores. So ayun, no? So ano pa yung nakita ko isa, second majority, I think halogenation. No, halogenation of nucleic acids, usually that's the letter A, no? That's the mechanism of action of your iodine, no? Your betadine. So it halogenates your nucleic acids, no? Kapag yung cross-linking naman, letter B, cross-linking of proteins, that's the mechanism of action of your aldehydes, no? Formalin, formaldehyde, glutaraldehyde, no? Choice C, intercalation of DNA. So yan naman yung mga mechanism of action of your acridine dyes. Okay, acridine dyes. That's also the mechanism of action. Yung acridine dyes that's used for wound disinfection, pero that's actually not very familiar for us, no? DNA intercalation in the outside of wound disinfection, that is also the mechanism of action of certain chemotherapeutic agents such as your doxorubicin, no, etc. Okay? Sige. So, ayun let's move on to our next question. Now, sige, we have a 75-year-old female that presents with chronic diarrhea, recurrent upper respiratory tract infections, no? She also trips easily at night when she goes to the bathroom, okay? Magandang buzzword yan. Okay? Physical examination, dry skin, keratin plaques, okay, on the temporal half of the conjunctiva. Now, which of the following is most likely deficient? Okay. Very good. Okay. Majority got it correct, no? It's your letter B, no? Retinol. Okay, so pero second majority is zinc. Pag-usapan natin mamaya yung zinc na choice. Now, in this patient, nagpe-present ng dry skin or your cirrhosis cutis, keratin plaques sa temporal half of the conjunctiva, that's your beta spots, that suggests your vitamin A deficiency. And vitamin A is just basically retinol, di ba? And retinol is involved in your epithelial cell differentiation as well as retinal pigmentation. Deficiency of your retinol or vitamin A therefore results in dermatologic and ophthalmologic manifestations. So dermatologic, dry skin, cirrhosis cutis, no? Beta spots, okay, ophthalmologic. It can also cause immunosuppression, no? Immunosuppression, and that explains yung mga recurrent upper respiratory tract infections of this patient. So in this patient, meron ka ring history that tripping at night, trips easily at night when she goes to the bathroom. That suggests your night blindness, nyctalopia. That's another manifestation of your vitamin A deficiency. So yung second majority answered your zinc, that's letter C, no? Zinc is tama naman, is an essential mineral. Madami siyang functions. Pero deficiency of your zinc can cause diarrhea and immunosuppression. Tama naman, both of which are observed in this patient. Although meron din while zinc deficiency also have your dermatologic manifestations, hindi siya cirrhosis cutis or hindi siya dry skin, but rather it causes your acrodermatitis enterohepatica. Okay, not your cirrhosis cutis. Okay? So, yun siya. Okay? So, vitamin A deficiency. So, gets bakit hindi siya zinc deficiency ha? It's your vitamin A deficiency or retinol. Okay? Sige. Now, we have a 10-day-old male that presents with vomiting and poor feeding. Now, he appears lethargic. Now, physical examination shows a diffusely increased muscle tone. Okay, diffusely increased muscle tone. His urine is noted to have a sweet smell sweet smell. Okay, his symptoms are most likely caused by the accumulation of which of the following. Parang nasabi ko na to kanina. Pero anyway, this is a 2 steps question. Pero I think nasabi ko na to kanina. Foreshadowing. Isayama, foreshadowing. Hajime, Isayama. Na-foreshadow natin yung question na to. Okay lang. This is fairly easy. That's fairly easy. Milk. Anyway, ayun, no? Majority got it correct. Very good, no? It's your isoleucine, no? Letter A. Okay, pero second majority answered letter C. Pag-usapan ulit natin mamaya. Okay, this is your isoleucine. Okay, so poor feeding, vomiting, lethargy, hypertonia, those are non-specific symptoms. Okay, those are non-specific symptoms. Pero our game changer here is your sweet-smelling urine. Okay, that strongly raises for the suspicion of your maple syrup urine disease. Okay, this is your maple syrup urine disease. So hindi pa tayo tapos doon. We have your diagnosis. We can rephrase the question, no? Accumulation of which of the following characterizes maple syrup urine disease? Now, the accumulation of your branch chain amino acids. O hindi pa tayo tapos. Ano ba yung mga branch chain amino acids? Tatlo. We have your valine, we have your leucine, we have your isoleucine. Okay? Nag-accumulate yung branch chain amino acids natin because of the deficiency of your branch chain alpha keto acid dehydrogenase. Okay? Now, if your MSUD or maple syrup urine disease is untreated, your neonates can develop your severe CNS damage and ultimately can lead to coma and death. So, how is your MSUD diagnosed? So, it's diagnosed by the presence of your alpha keto acids of branch chain amino acids in the serum. So, how do we treat? Avoidance of your dietary branch chain amino acids and thiamine supplementation. Bakit mag-supplement pa rin tayo ng thiamine? No? So, your branch chain branch chain alpha keto acid dehydrogenase. So, kailangan niya ng 5 na cofactor, no? Your vitamin B1 or your thiamine, vitamin B2, riboflavin, vitamin B3 or your niacin, vitamin B5 or your pantothenic acid, as well as your lipoic acid. Familiar? Alpha keto acid dehydrogenase, parehas sila ng cofactors with your pyruvate dehydrogenase complex as well as your alpha keto glutarate dehydrogenase complex. So why do we do thiamine supplementation? It's to salvage kung ano pa yung natitirang functional na enzyme at paganahin siya. No, just in case, no? So, pero definitely we must avoid dietary branch chain amino acids. No, ulit yung second most common answer natin, it's your phenylalanine, no? So again, this na pag-usapan natin sa first question na laging madalas na pagbabaliktad yung maple syrup urine disease and your phenylketonuria. So maple syrup urine disease, from the name itself, maple syrup, it's sweet, no? Sweet smelling urine, no? Burnt sugar smelling urine, that's your maple syrup urine disease. Do not forget, no? Burnt sugar. Isipin nyo na lang itsura ng maple syrup. It looks like burnt sugar. It looks like caramel, no? In phenylketonuria, mousy odor, no? Mousy odor. Ang iniisip ko dyan, yung parang phenylketonuria. Alam niyo yung itsura ng phenylalanine, di ba? Di ba may benzene ring siya? Tapos iniisip ko cheese yun. Kaso mouse. ADHD. Anyway, so yun, again, don't, tawag doon, ingat tayo doon ha. Phenylalanine accumulation occurs in phenylketonuria, not in your MSUD. Okay? So, na-foreshadow natin yan kanina in our first question. Okay lang yan, no? This time. Okay? Sige. Let's move on to our next question. We have a 5-year-old female presenting with painful sunburns with minimal UV exposure. Now, this patient have an ulcerated nodule on the left cheek. Okay, so PE shows decreased visual acuity. Now, biopsy of the nodule shows squamous cell carcinoma. Now, impairment of which of the following proteins, okay, is most likely the cause of this patient's condition. Okay. Sige, mamaya. This is ito kasi with biochem, when it comes to our genetics, no? Kasi syempre kasama yung genetics in our biochemistry, no? Ito yung minsan na minsan na take for granted natin, yung genetics part ng biochem. Na, although hindi naman usually lumalabas kaano, pero who knows, di ba? Who knows? So, we still have to study. Anyway, the answer to this question is your excision endonuclease, no? Yung second majority actually yung naka-answer, 33%. Now, in this patient, meron tayong this young patient, no, 5-year-old female, meron tayong history of your extreme sensitivity to light, okay? Kasi painful sunburns with your minimal UV exposure, meron tayong squamous cell CA, decreased visual acuity, no? So that's indicative, no? That's consistent with your xeroderma pigmentosum. So meron tayong diagnosis, xeroderma pigmentosum, no? Xeroderma pigmentosum, it is an autosomal recessive, no? Again, autosomal recessive, enzyme ang problema. Okay? Enzyme ang problema. So autosomal recessive, xeroderma pigmentosum. Okay? Now, yung xeroderma pigmentosum, it is a disease in which the ability to repair your UV-induced DNA damage is defective. For that, your UV radiation results in your dimer formation, no? Pyrimidine dimer formation. Now, these pyrimidine dimers can distort yung helix ng DNA. So, basically, that will disrupt your DNA replication. Now, your pyrimidine dimers is usually repaired by your nucleotide excision repair in the G1 of your cell cycle, okay, in which your damaged oligonucleotides are first recognized, then excised. Okay, so that process is carried out by your excision endonucleases. Okay, excision endonucleases. So pag may mutation ka sa excision endonucleases, that will cause xeroderma pigmentosum. Second ano natin is your RB gene, no? RB nuclear protein. Dito pa lang di ba, autosomal recessive, RB nuclear protein. So structural, parang hindi, di ba? So anyway, your RB nuclear protein is a tumor suppressor gene, no, responsible for the regulation of entry sa cell division. So wala siyang role, no, in DNA damage repair. Pero mutations of your RB results in RB, retinoblastoma. Another one is your osteosarcoma. Okay? Don't forget yan, ha? Pag RB, retinoblastoma, and osteosarcoma. Okay? Sige, second to the last. Now, you are studying the structure of the amino terminal of the Huntingtin protein through your X-ray crystallography. Okay? Now, saan ba ako? You determined that the terminal region has an alpha helix conformation. Now, which of the following forces is responsible for maintaining this conformation? First few chapters, no? First few chapters of our biochem. All right, majority got it correct. It's your hydrogen bonds, no? Letter B. Although second majority got letter A. Okay? It's your hydrogen bonds. Pag-usapan din natin yung disulfide, mabilis lang. So, alpha helix is a secondary protein structure. So, your hydrogen bonds between the hydrogen atom of the amino group of one amino acid and the oxygen atom of the alpha carboxyl group of the neighboring amino acids are responsible for the secondary protein structures. Ano ba yung mga secondary protein structures natin? Alpha helices, beta pleated sheets, no? So, hydrogen bonds, basically secondary protein structure. So, disulfide bonds, on the other hand, that's responsible for your tertiary and quaternary protein structure. For instance, the bonding of your pre-procollagen alpha helices to form your procollagen, diba? They do not play a role in your alpha helix formation. Okay? Last question for this morning. Okay? We have a 5-day-old male presents with lethargy and vomiting after breastfeeding. Labs show an elevated serum ammonia. Now, further studies show a deficiency in N-acetylglutamate synthase. Now, the activity of which of the following enzymes is most likely directly affected by this genetic defect? Okay? Yeah. Alright. So, tie up, no? Letter A and letter B. Pero 1% mas lamang yung letter A. Okay? That's the correct answer. Your carbamoyl phosphate synthetase 1. No? Now, your N-acetylglutamate synthase, this enzyme, produces your N-acetylglutamate. Okay? Now, your N-acetylglutamate serves as an allosteric activator of your carbamoyl phosphate synthetase 1. Okay? So that's actually the first enzyme in your urea cycle. That's a mitochondrial enzyme. It converts your bicarbonate and your ammonia into your carbamoyl phosphate. That uses 2 molecules of your ATP. Okay? That this first step is the rate limiting step of the urea cycle. Okay? The rate limiting step of your urea cycle. So choice B, your OTC, ito yung tie-up natin. OTC is also a mitochondrial enzyme, pero a deficiency of this enzyme will cause ammonemia, but tama naman, it will cause elevated serum ammonia, pero yung activity of your OTC will not be affected by your N-acetylglutamate levels because hindi siya your N-acetylglutamate is not an allosteric activator of your OTC. Okay? Now that ends our Quizmaster session, and today is Monday, so Attack on Titan time. Eren and the Rumbling, Now, parang boards lang yan, no? Parang sasabak lang tayo sa rumbling, no? I always say that just like Eren Yeager, any strong emotion can serve as motivation, no? So, any strong emotion can serve as motivation for your boards, and 3 weeks to go. Good luck.
Thank you so much. Thank you so much, Dr. Omalien. Guys, let's give naman a virtual clap para kay Dr. Omalien. Ayan, okay. Hi, Doc Ian. Do you have any words of wisdom for our BBs?
Hello guys, good morning and happy Valentine's. I think na mention na ni Doc James lahat ng mga gusto ko ding sabihin. Guys, konti na lang, no? Few days na lang, actually few days na lang before your board examination. Remember, you still have time, but the time is not that much. So maximize your time well and steer schedule. Always pray, guys, and stay healthy. Yun lang. Doc James, see you. Lapit na.
Okay, thank you very much, everybody, for joining our morning session. Again, happy Valentine's Day. Okay, text your loved ones, text your mother, your fathers. Okay, and wag nang makipag-date. Ang gusto nyo, pareho kayo mag-aral, pero naka-open lang yung yung Discord nyo, ganyan, or something. Charara. Okay. So, happy aral, everyone. I will see you again tonight for the next Quizmaster. Okay? Bye-bye!
Thank you, Doc Lala. Thank you, Doc James. Bye, guys.
Yes.